Hello, welcome to the CIRS Healing Collective Expert Guest Video Series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a Shoemaker Proficiency partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you.
What is Lyme disease? So it's defined as an infection by Borrelia burgdorferi. Borrelia is a spirochete. It's a twisted bacteria, which is that picture there. And I think it's also important to note that syphilis and leptospirosis are also caused by a spirochete. These can really be strong pathogens. Another name for Lyme is deer syphilis. The next question is, all right, so what are these co-infections? And also, if you have brain fog, just relax. I'm going to say a lot of Latin words. I want you to, and through this talk, I just want you to get the general concepts. You can always go back to details later. So some of the common infections that can occur along with Lyme is Bartonellosis. This is caused by a gram-negative bacteria called Bartonella. Bartonella henselae, if that's the species that's infected you, it can also be known as cat scratch disease. Babesiosis, that's a protozoan parasite called Babesia. And again, here, another similar pathogen is malaria caused by the Plasmodium. That's also a very tricky illness to be able to treat. And also Toxoplasma gondii, toxoplasmosis, that's also a very difficult pathogen. It's also related to schizophrenia. Tick-borne relapsing fever, that's another spirochete bacteria, Borrelia recurrentis, and you're getting a recurring fever with that. Borrelia miyamotoi disease, just move you guys over. That is another spirochete bacteria, Borrelia miyamotoi. Rickettsiosis, that's also known as Rocky Mountain spotted fever. That's a gram-negative intracellular Rickettsia bacteria. This next one is a little wordy and kind of confusing. Anaplasmosis, which is also known as human granulocytic ehrlichiosis. It affects the granulocytes. And ehrlichiosis, this is human monocytic ehrlichiosis. It infects the monocytes. These are both gram-negative intracellular bacteria of the names related to their illness name. And then lastly, another possible co-infection is Powassan virus. This irritates the brain and the meninges, causing encephalitis and meningitis, among other symptoms. In Europe, it's tick-borne encephalitis virus. And again, here, other viruses that we're familiar with that infect the nervous system would be rabies, right? Really inflames the brain and the spinal cord. And then shingles herpes zoster, caused by the varicella zoster virus. And if you yourself have had it or you've seen someone who's had it, this really can be quite painful and hard to treat. How are we getting these infections? Lyme is transmitted by ticks. Bartonella can have many vectors, so fleas, lice, sandflies, mosquitoes, ticks, spiders, bed bugs. Babesia is typically carried on ticks. Tick-borne relapsing fever, lice and ticks, Borrelia miyamotoi, ticks, rickettsia, ticks, lice, mites, anaplasmosis, ehrlichiosis, ticks, Powassan, and tick-borne encephalitis virus by ticks. And also ticks, I grew up in Connecticut, so I think of, ticks attaching to deer, and they're like, oh, deer are here, so, I have to worry about it. But they can attach to any mammals, so rodents, rabbits, they can also attach to birds. So they can attach to a bird and the bird flies, who knows where. And also reptiles. That's surprising. That's a hard thing to latch onto. All right, prevalence, which means how many people have it. So before we get into the numbers, there are a couple of issues with underreporting. I think the first is that it's not even really considered as part of the differential. So you're just not even testing for it. And then the second issue, and I'll speak a little bit more to this, are the issues of false test negatives. Despite this, the CDC reports there's about 500,000 diagnosed each year with Lyme disease. And this is more than HIV and breast cancer combined. That's a pretty staggering number. LymeDisease.org surveyed 3,000 patients. They found that half of them have one co-infection and a third have 2 or more co-infections. Again, I think this is underreported for the same issues of Lyme. You're like, okay, I'll just run a test for the Borrelia burgdorferi, but you're not running it for Bartonella, Babesia, et cetera. And also there are similar issues to getting false negatives. Okay. I'd also like to say that you don't need the Borrelia burgdorferi to get the other infections. That's a little bit, I think co-infections is a little bit of a misnomer. And then also Dr. Alan Gruning, who has a large practice in Florida, has been using, I'll speak about a particular lab a lot with his patients. He's seeing about 90% test positive for Lyme, and most have co-infections. So when I learn about infection in Eastern medicine, I'm always thinking about the interaction between that pathogen and the person. And that's going to give me the symptoms that the person has. So on the left here, there's a very strong woman who's about to go swimming. So the person could be strong like she is, or they can be weak. And the pathogen, again, can kind of be this strong pathogen or weak pathogen. And when either of those variables meet, that's when we get the outcome. Western medicine calls this host pathogen response. This is a bit wordy. I'm going to break it down for you, but I think it's important as CIRS patients to understand this concept. So virulence, which means the strength of the pathogen, is one of a number of possible outcomes. Like I just said, you have a strong or weak person, a strong or weak pathogen of host microbe interaction. As such, microbial virulence is dependent on host factors, as exemplified by the pathogenicity of virulent microbes in immunocompromised hosts and the lack of pathogenicity of virulent pathogens in immunocompetent hosts. Pathogen-centered views of virulence assert that pathogens are distinguished from non-pathogens by their expression of virulence factors. Although this concept appears to apply to certain microbes that cause disease in normal hosts, it does not apply to most microbes that cause disease primarily in immunocompromised hosts. So as CIRS patients, our immune system is dysregulated, right? We're at that disadvantage. And so in the community, it's shown, well, you get bit by a tick, we give you antibiotics for 6 weeks or whatever, and then you're fine. But this is a Western way of saying that it depends on the host, that disease or that pathogenicity, the host is also a factor. Okay. So in Eastern medicine, goo is more related to the gut. This would be you have contaminated water, contaminated food, and you have most likely a helminth infection. You can also have fungi and other infections. And then Nue, what we're speaking of today, this is from an insect bite, and it more often inflames the nervous system. If you look down to the lower left, a pictogram is one way of expressing their language. And so it's a couple of worms in a pot. And what that imbues is that this is a multi-parasitic infection. It's not just one thing. This is a chronic multi-parasitic infection. And then if we look in the upper left, there's a picture of a mountain, there's a tunnel, right? There's a hole going through it. Another way to express Nue syndrome, goo syndrome, is in a hexagram, and it is mountain over wind. Wind, we say, is the carrier of 100 diseases, so it implies infectious disease. And then mountain, if you have a solid foundation and wind comes at you, it should go up and over you, or it should go around. It doesn't come through you. This tunnel here is man-made. It's a vulnerability in the mountain. So just like with Dr. Shoemaker, we have to have exposure, right? And through my lens, it's multi-parasitic, which, as we just saw with the co-infections, can be bacteria, can be virus, can also be protozoa, and can also be fungi and helminth. And then you need the susceptibility. So Shoemaker, HLA-DQDR, and then also in modern day, antibiotic use is going to weaken the immune system. Glyphosate, which unfortunately we're all exposed to, even if we're eating organic, that's what's in Roundup on commercial farming. It's water soluble, so it goes up into the clouds and clouds can move and it can rain down elsewhere. Vaccinations, Yale just published a study on the mRNA vaccines and damage that they're seeing. Also trauma, and then particularly younger. So ACE means adverse childhood experiences. You know, both of these dysregulate the nervous system, and then very strong experiences like grief or loss. And that can, those all give you the susceptibility.